Let's take a look at a few of the problems and solutions to an important clinical procedure called IV therapy. Unfortunately, there are plenty of problems that need to be solved for patients, for nurses, biomedical engineers, infection control, and quality managers in hospitals. There's a technology or set of technologies that we developed called Breeze that changes the way the IV fluid is delivered and addresses each of these needs at lower cost. Rather than create a new medical device company, we're simply licensing this technology and building modules for other medical device companies to use in their infusion systems and patient monitoring systems. It's a big problem. Virtually every hospitalized patient is getting an intravenous infusion. Yet the FDA has recalled dozens and dozens and dozens of pumps because they failed to deliver safely and effectively. Nearly 250,000 devices were ordered by the FDA to be removed and destroyed from the market. And each and every day, about 1 million alarms go off at the bedside that don't need to. We're familiar with the deaths caused by hospital errors. Well, a good portion of those are related to IV pumps. Yet it's a big business. 5 companies enjoy revenues in the hundreds of millions of dollars per year. Yet, with all of that revenue and all of the problems that are still yet to be solved, there hasn't been a breakthrough technology in nearly 40 years. So we're going to look quickly at just a handful of the advantages that this new technology can afford. So we address each of these 4 key areas and do it for less cost than the current systems on the market today. Let's start with air bubbles. Air bubbles are an inevitable part of an infusion. Fluids warm up, air gaps are created when connections are made. They are an inevitable part, yet when an infusion pump encounters an air bubble, bad things happen. The medication stops. The patient family is disturbed by an alarm at the bedside, and it greatly interrupts and interferes with the nurse's workflow. So wouldn't it be great if you could actually remove the air from the line in the first place and avoid the need for that alarm? So here you see in the upper line fluid, liquid, and air bubbles going into our infusion device, and on the bottom the flow going to the patient where there's no air, no patient hazard, no workflow interruption. So wouldn't it be great if you had a pump that could eliminate air like this? Well, that's what we did. IV pumps are also complex and unreliable. If you visited the hospital biomedical engineering department, it might look to you more like a pump factory, where pumps are waiting in line to be repaired, for troubleshooting, for calibration, for maintenance. It takes a lot of work to maintain a fleet of IV pumps. Wouldn't it be great if you could replace that complexity with something that was simplified and highly engineered? Well, that's what we did. Now, when pumps go from one patient to the next, they have to do so year after year after year, and it's a real challenge to clean these pumps in between one patient and the next. In fact, what would you do to clean this device? Switches and levers and cams and doors and gears. It's a very difficult product to clean. And wouldn't it be great if you could just take one hand and with a wipe of a disinfectant towel, clean off the pump? Well, that's what we did. Infection control is a lot more than just cleaning a pump. Ultimately, you want to make sure that you deliver antibiotics on time without dilution and without spilling a drop into the environment. Well, wouldn't it be great if you could have a pump that would prime itself without spilling any antibiotic into the environment, and one that was able to manage the delivery on time without chance of dilution and minimize the number of connections you needed to make? Wouldn't it be great if you could do that? Well, that's what we did. So altogether, wouldn't it be great if you could reinvent a procedure that helps so many patients and virtually every caregiver in the hospital and many, many tens of thousands of patients at home? Well, that's what we did.